And as the impacts from COVID-19 continue to grow right here in Missouri, we're talking with local health officials about how they're dealing with this pandemic. We're joined now by Dr. Mark Wakefield from MU Healthcare. Doctor, thank you so much for being with us this morning. I know it's definitely a busy time.
Good morning, and thank you.
Good morning. So we'll just jump right into the first question. Does MU Healthcare have a contingency plan in place if there's a surge in patients?
Yes, we do. We have a well thought out and good contingency plan for a surge of patients.
Very good. Now, what impact is this outbreak having on any vulnerable patient groups?
Well, we worry significantly about patients who are vulnerable, which are patients who are older, have other medical conditions like lung disease or kidney disease, which I take care of those type of patients. And we know they appear to get sicker quicker and more severely if they're exposed to COVID. So it's especially important for them to keep social distancing, which is sometimes difficult with their medical conditions, and to wash their hands and stay in contact with their healthcare providers.
What's the latest situation with personal protective equipment from MU Healthcare? I know that's been a lot on the minds of people, just making sure that the people on the front lines are protected with that equipment.
So currently we have enough personal protective equipment for the time being, but contingency plans are requiring that we take careful supply chain measures to make sure that we have enough for this potential surge and for the duration of the illness.
Do you think that MU Healthcare will have enough PPE?
I think so. We're prepared to control our supply chains as much as possible. It does, I think, create some apprehension about the changing recommendations that come from different resources.
And I know that the CDC has now recommended that people just like me, when we go to the grocery store, that we now cover our faces. I just want to reiterate that that does not mean that we are wearing N95 masks or anything like that. Do you have any recommendations for people potentially using their own masks to step out to the grocery store these days?
So I believe that is the CDC recommendation now, and I think keeping them clean and not using them as a crutch. I mean, you can't stop washing your hands and keeping social distance just because you're wearing a mask.
And do you have any new measures for how MU Healthcare is protecting your own people on the front lines?
Well, we've continued with our visitor limitations, which is an inconvenience and sometimes more troublesome than that for our patients and visitors, but it's important to persistently protect social distancing.
Absolutely. Dr. Mark Wakefield, thank you so much for being with us this morning. We'll get back to you coming up in just about 20 minutes. We've got some more questions for you. Again, we really appreciate your time.
Thank you.
And as the impacts from COVID-19 continue to grow in mid-Missouri, we're talking with local health officials about how they're dealing with this pandemic. We're joined now by Dr. Mark Wakefield from MU Healthcare. And Doctor, thank you so much for being with us this morning.
Good morning. Thank you.
Good morning. And so I wanted to point out that, we're monitoring the number of tests and patients that MU Healthcare has seen so far. And a lot of people in the community, too, they just want to know what's the latest number, how many people have this virus. We've kind of seen a little bit of a decline. Do you worry that people might be reading too much into that decline?
That is definitely a possibility. We did limit the number of hours on the weekend for our drive-through testing. And the hospital, though, has maintained about 3 or 4 inpatients with admissions about the same rate as discharge. And the amount of testing has been fairly steady at about 100 to 150 patients per day. So on one hand, I think our social distancing, hand washing, and precautions are helping to prevent a surge of patients right now. But it's also a wait and see kind of attitude. Is this going to carry us through at this rate, or are we going to have increased patients in the next week or two?
And Speaking of that, we've been hearing about the peak. When is this peak going to happen? When are we going to start to level off? We actually saw new data yesterday that shows, and we actually have this on the screen for our viewers right now. These are the latest numbers, and it shows that Missouri's peak is actually expected around April 19th. Is this something that MU Healthcare is expecting, that same peak around mid-April now instead of mid-May?
Well, that predictor changed pretty dramatically from Friday to Monday, and that was driven, I believe, in part by the statewide stay-at-home. And that predictor is getting more information and more data, which is helping us make better predictions. So we're prepared for a peak in the next week or so, but also I think we have contingency plans that maintain readiness for the next 3 to 6 weeks.
And that is a hard predictor because a peak next week could look a lot different than a peak from, 4 to 5 weeks from now. Do you think MU Healthcare is prepared to have enough personal protective equipment, enough hospital beds, enough ventilators for anything for those next 6 weeks?
There's definitely contingency plans, and we've talked in the past about flattening the curve, which makes the peak less dramatic but prolongs the course of the pandemic. And if we follow those kind of modeling, then it looks like we'll have sufficient beds, and that's what these national models are predicting now. I think those also are statewide models, so there's some likelihood that Columbia will behave differently and maybe lag behind St. Louis, which seems to be driving the model at present quite a bit.
Okay, Dr. Wakefield, thank you so much for being with us this morning. We'll check back in with you coming up in just about 15 minutes, but we do sincerely appreciate your time. I know it's very busy right now.
Thank you.
Thanks. As the impacts from COVID-19 continue to grow right here in Missouri, we're talking with local health officials on how they're dealing with this pandemic. We're joined live now by Dr. Mark Wakefield from MU Healthcare. And Doctor, thank you again for being with us this morning.
Good morning. Thank you.
Good morning. And I wanted to ask you about something that you had mentioned at City Hall a few weeks ago during a COVID-19 briefing. You had said that it's really not a good idea to test asymptomatic patients because there is still a possibility for false negatives. Now, with these rise in cases of people not really showing any symptoms, have your thoughts changed on that at all?
So at that point, at that news conference, we had very limited access to testing. So our position on testing patients has changed. I think the asymptomatic person probably still should not be tested. I mean, the test is a little bit invasive. One of my friends got tested and had a pretty good bloody nose afterwards, and wrote a funny post on Facebook about how you should prepare yourself for that test. But I know that from an epidemiologic standpoint, especially with concern of subsequent reintroduction of the virus, and knowing what the population exposure is becomes important. But I think we've lowered or changed our standards some. In other words, we don't need to have a travel link once we had community spread of the virus to trigger testing. So I think the doctors who are ordering the testing are using a lower threshold of minor symptoms, but a totally asymptomatic patient probably does not benefit from testing, and I'm not certain the community benefits from that testing at this point.
Absolutely. So I guess this might just be more of a hypothetical question, but if MU Healthcare had an unlimited amount of testing supplies, would you feel the need to test everyone in Boone County to see how they've tested that day?
Not necessarily. I think in the long term, what will really be important is developing antibody tests to know if people have immunity, and that would be a blood test. And I know that labs are working very quickly to develop a reliable antibody test. But as I understand it, the family of coronaviruses have some cross-reactivity, so the utility of those antibody tests have to be proven before they're widely deployed. If a test becomes easier to administer for local exposure, I think we would have more widespread use of testing, but right now I think limiting it to patients in whom knowing they have a diagnosis is going to change their course. One thing that if you get tested, you kind of have to quarantine until you have a negative test. So that has a lot of implications. So if you're sick enough to get tested, which might be mild upper respiratory symptoms at this point, you got to treat yourself like you're positive until you know that you're negative.
Okay. Dr. Wakefield, thank you so much for being with us today, and give our sincere gratitude to everyone on the front lines there working to protect us.
Thank you very much.
Thank you. You have a good day.